Hello guys, welcome back to the masterclass. Here is the next important essay type question of applied microbiology. Enumerate opportunistic mycosis. Explain the pathogenesis, clinical significance, and laboratory diagnosis of candidiasis. Guys, you can easily make notes by watching this video and also by reading the transcripts available below the description of this video. So let's start because you are getting the complete and to the point answer in these videos. Start with the definition. Opportunistic mycosis are fungal infections caused by fungi that produce disease mainly in individuals with impaired immunity or weak host defenses. Remember, impaired immunity and weak host defenses are two different things. So next, enumeration of opportunistic mycosis. Enumeration means to make a list. Note it guys, this is also the answer for very short 2 marks question. So the important opportunistic fungal infections are Candidiasis. You need to mention the particular fungus responsible for this. So Candidiasis is caused by Candida albicans, most common type of fungal infection. Aspergillosis caused by Aspergillus fumigatus. Cryptococcosis caused by Cryptococcus neoformans. Mucormycosis caused by Mucor species. Pneumocystitis pneumonia caused by Pneumocystitis giroversi. Penicillosis, also known as Talaromycosis, caused by Talaromyces marnefi. Guys, if you are watching this channel for the first time, please watch the previous videos for more questions and answers already explained. In all videos, you will find the question in the thumbnail. So, start with Candidiasis. Definition. Candidiasis is an opportunistic fungal infection caused by Candida albicans, a fungus that normally inhabits, means normally present in human body, where? In the skin, oral cavity, gastrointestinal tract and vagina. Next, pathogenesis of candidiasis. Note it guys, pathogenesis of candidiasis is also 5 marks question, and here is the answer. Because already I have said earlier, the essay type questions are combination of short, very short and MCQ questions. Okay, so give the number like 1, 2, 3, 4 like this. So number 1, source of infection. Candida is a normal commensal organism, means normally present in human body. Infection occurs due to overgrowth of endogenous flora, means the fungus available inside the body. Number 2, predisposing factors. That means what are the factors which trigger the fungal infection, like diabetes mellitus, HIV AIDS, malignancy, prolonged broad spectrum antibiotic therapy, corticosteroid or immunosuppressive therapy, pregnancy, indwelling catheter and intravenous lines. Next guys, the last part of pathogenesis, mechanism of disease. Make a flow chart here for maximum marks. Start with predisposing factors, already we discussed. Then overgrowth of Candida albicans leads to adherence to mucosa, and here hyphae formation. These hyphae, they produce the enzymes, proteases and phospholipase through which they do tissue invasion, and after tissue invasion they produce superficial infection, and which leads to mucocutaneous infection, and if untreated, systemic infection. Also forms biofilms on catheters and medical devices. So next part is clinical significance. Make a note, this is also a 2-mark question, and here is the answer. So number 1, superficial candidiasis, that includes oral thrush, angular cheilitis, vulvovaginal candidiasis. Next, mucocutaneous candidiasis, that includes chronic infections involving skin, nails and mucous membranes. The last one is very important, systemic candidiasis. This includes candidemia, endocarditis, urinary tract infections, meningitis, hepatosplenic candidiasis, septic shock in case of severely immunocompromised patients, and high mortality if untreated. So next, laboratory diagnosis of candidiasis. Note this guys, this is also a 5 marks question, and here is the answer for you. Specimens: oral swab, vaginal swab, sputum, blood, tissue biopsy, CSF when indicated. Direct microscopy, 10% KOH mount to detect budding yeast cells with pseudohyphae. Gram stain is used to detect gram-positive oval budding yeast cells with pseudohyphae. Culture is done on suborate dextrose agar. Underline this. Very specific for MCQ. SDA, suborate dextrose agar, where smooth colonies are formed within 24 to 48 hours. Germ tube test, underline this, for rapid identification, where positive results are found at 37 degrees centigrade in 2 hours. Next, Crow-Mager Candida. This test is done to differentiate Candida species based on their color. And the last one, blood culture. Underline this, gold standard for candidemia, the systemic infection. Treatment, guys, mention just few drugs to score better in this question. Topical clotrimazole, oral fluconazole, and systemic amphotericin B, and underline caspofungin. Then provide few points of prevention: good personal and oral hygiene, control of diabetes mellitus, avoid antibiotic abuse, proper care of IV lines and urinary catheters. And finally, give the conclusion to the essay type question. The most common opportunistic fungal infection occurs due to Candida albicans. Characteristic microscopic findings include budding yeast cells and pseudohyphae. Prevention and proper care can prevent fatal systemic candidiasis like candidemia. So this is the answer of the essay type question. Guys, if you like the video, give a thumbs up here. Please drop your comment. I must know what you feel about the videos of this channel. If you have not subscribed, please subscribe, share with others. Stay tuned for the next video. Till then, take Take very good care of yourself.